Hi guys, so this is my response to this week's discussion board. The first question being, how would you assess Kendrick for suicidal/homicidal risk? What questions might you ask? So Kendrick's statement, I have enough pain pills at home to do what I need to do, is a direct suicidal warning sign. I would immediately shift into a structured suicide risk assessment while remaining calm, compassionate, non-judgmental. I feel like if you were in that situation and a client expressed that, getting emotional and panicked would only make the situation worse. So trying to remain as calm as possible while also maintaining being professional, but also the compassion that the client needs during that time. I would use elements from the Columbia Suicide Severity Rating Scale, the framework and best practices in suicide assessment. And key questions I would ask are clarifying intent. When you say you have enough pills to do what you need to do, can you tell me more about what you mean? And are you thinking about ending your life? Assessing Kendrick's ideation. Have you thought about killing yourself? Have you had thoughts about killing yourself? How often are those thoughts happening? Assessing Kendrick's plan. Have you thought about how you would do this? Have you decided when you might do this? Assessing access to means. Do you currently have access to those pain medications at home? Have you taken any steps towards using them? Assessing his intent on a scale from 0 to 10. How strong is your intention to act on those thoughts? What has stopped you from acting on them so far? Assessing the protective factors. Who are the important people in your life right now? What still feels meaningful to you? And what has helped you cope during this illness? Assessing his mental state. Does he have hopelessness, depression, a desire to escape suffering, and a desire to die, or a desire to escape suffering versus desire to die, and demoralization versus clinical suicidality. Because he is terminally ill, I would also explore, is this despair? Is this a request for control? Is this fear of future suffering? Is this related to untreated pain or depression? There's no indication of homicidal ideation, but I would still briefly screen, have you had thoughts of harming anyone else? For the second question, what course of action would you take with Kendrick? What other factors might you consider? So my immediate priority would be Kendrick's safety. So if he expressed active intent, a specific plan, access to means, an immediate time frame, I would want to make sure that he is safe and not able to access or follow through with his plan. And then I would notify a medical team immediately and initiate suicide precautions. I would consult psychiatry and consider involuntarily hold if necessary, depending on what state and what the laws are in that state. And as a hospital counselor, I am a mandated reporter when there is imminent risk to self. And it sounds like this is a situation where there is immediate risk to himself. So if after that questioning, a risk is present but not imminent, so if he has ideation but no imminent threat, I would develop a collaborative safety plan, restrict access to lethal means like his medication that he's talking about taking. I would involve trusted support, whether that be friends, family, really anyone that he specifies that he is trusting. I would consult oncology with I can't pronounce this word, but palliative care. Screen for depression and refer for psychiatric evaluation, and explore hospice services. And then some additional factors would be untreated depression. Terminal illness significantly increases risk for major depressive disorder. Looking into his pain control, is his pain adequately managed? Care involvement, palliative care often reduces suicidal ideation by addressing suffering holistically. Does he have spiritual existential distress? He may be experiencing loss or meaning of identity. His autonomy and end-of-life ethics, his cultural beliefs about deaths and his family system. Does he have support? Are they aware of this prognosis? And then the third question, what techniques or ideas from Dr. Friedenthal's podcast might you use with Kendrick or another client? So for this one, sorry, I lost my spot. I would ask directly about suicide. Dr. Friedenthal highly encourages clinicians to ask directly and clearly, are you thinking of killing yourself? Research shows that this does not increase suicide ideation. It reduces secrecy and shame. I'd take a collaborative stance rather than being authoritarian. So saying things like, help me understand what makes death feel like it's the best option right now. This aligns with motivational interviewing principles. Exploring ambivalence. Friedenthal highlights that most suicidal involvement are ambivalent. So I might ask, part of you wants to end pain. Is there any part of you that wants to keep going? What would you change? What would need to change for you to feel less pulled towards ending your life? What are his reasons for living? So instead of forced positivity, what has kept you alive this long through everything you endured? Slowing down the process, encouraging delay. Would you be willing to hold off on any decision while we explore other options together? And then clinical balance in terminal illness. This is where counseling becomes ethically nuanced. With a terminal client, desire to die may reflect existential suffering, not psychiatric suicidality. We must assess for treatable depression. We must address dignity, control, and suffering. We must not assume all desire for death equals mental illness. And so I would integrate existential therapy, meaning-centered therapy, and dignity therapy. So this is a high-risk situation requiring immediate assessment and multidisciplinary collaboration. But I think the most important first move is to calmly and compassionately directly assess the suicide risk so that you can make a plan from there, and making sure that you aren't in a panic state and you aren't being judgmental towards the client, and keeping the client safe while exploring a deeper layer of why he is suffering.